If someone you love has kidney disease, heart disease, or diabetes, I need you to hear this. These are not three separate problems that just happen to end up in the same person by bad luck. They are three houses on the same block sharing the same wiring, the same water lines, and the same weather. When one house catches fire, the other two are already at risk. By the end of this video, you are going to understand exactly why your doctor keeps checking your heart when you came in for your kidneys, and why controlling your sugar isn't just about diabetes. It's about protecting the whole neighborhood. I'm Erica, a nurse practitioner who has spent over 20 years in healthcare. I currently work in nephrology and see patients from early CKD to dialysis. And this is the Kidney University. Let's set the scene. Imagine your body is a neighborhood. The heart is Main Street, and it's the road that everything travels on to get where it's going. If Main Street is good, then the deliveries arrive on time and nothing backs up. The kidneys are your water and trash service. They filter out what you don't need, keep your fluid levels balanced, and honestly, they keep the whole place from turning into a dump. Diabetes is what happens when the power system in the neighborhood is broken. The electricity keeps surging, keeps short-circuiting, and over time, that bad wiring starts frying things that it was never supposed to touch. Here's a number that should get your attention. 1 in 3 adults with diabetes has CKD. And diabetes and chronic kidney disease are two of the strongest risk factors for developing heart disease. And that's not a coincidence. That's the neighborhood effect. When the power company, the water and trash service, and Main Street are all sharing the same broken pipes and wires, a problem in one house never stays in one house. It spreads. Before we go house to house, I want you to understand something important. These three conditions aren't sneaking up on you independently. They're caused by the same troublemakers: high blood sugar, high blood pressure, obesity, a diet that's heavy on the processed foods and light on real food, not moving your body enough. And yes, family history plays a role too. These risk factors, they don't pick a lane. They damage blood vessels and organs everywhere at once, which means the whole neighborhood wears down together, not one house at a time. So when I have a patient ask me, why do I need to worry about my heart? I'm just here for my kidneys. This is exactly why. Because it's not three separate diseases. It's the same bad neighbors causing chaos all up and down the block. Let's start with diabetes. Diabetes is fundamentally a problem with how your body handles insulin. When the system breaks down, sugar builds up in the blood instead of getting into the cells where it's supposed to be. Picture sticky syrup sitting in pipes that are supposed to have clean running water through them. That sticky sugar doesn't stay contained. It damages small blood vessels everywhere in the body, including the ones that supply the heart and kidneys. And that's the direct line between uncontrolled diabetes and a higher risk for both CKD and heart disease. Think of diabetes like electricity that keeps surging and short-circuiting. At first, it might just flicker a light, but over time, that constant surging fries the wires in the heart house and the kidney house too, because they're all on the same electrical grid. And this is why we just don't treat diabetes with, oh, take your metformin and we'll see you in 3 months. We're watching your kidneys and your heart at the same time because the wiring damage is already spreading before you felt one symptom. Now let's go next door to the kidneys. Your kidneys have one job that matters here: filter waste, remove extra fluid, and help regulate your blood pressure. When chronic kidney disease sets in, that filter gets clogged up and the system weakens. When the filter isn't working right, toxins and extra fluids start to build up in your body. That buildup raises your blood pressure and it puts direct, constant stress on your heart. This is exactly why CKD by itself is considered a major risk factor for heart disease or a heart event, even in someone who's never had diabetes before. CKD is like the neighborhood's water and trash service breaking down. Trash starts piling up on the curb, water backs up into the street, and it doesn't take long before every house on the block is dealing with the consequences, not just the one house where the pipes were broken. If you've ever wondered why a nephrology visit always includes a blood pressure check and a conversation about your heart, this is exactly why. We're not being thorough for the sake of it. The kidneys and the heart are that closely tied together. Now to Main Street, the heart. When someone has diabetes and CKD, the heart is working overtime. It's pumping harder to push the blood through those blood vessels that are now stiffer and more damaged than they should be. That extra strain is what drives high blood pressure, heart failure, strokes, and heart attacks. And that risk climbs even higher when CKD and diabetes exist together. Picture Main Street, full of potholes, and the delivery truck that's supposed to deliver the supplies to every house is overworked and breaking down. When that truck can't keep up anymore, deliveries to every single house get kind of iffy. And that's what's happening to your organs when your heart is under constant chronic stress. Here's where it gets serious. So I want you to really sit with this part. Uncontrolled diabetes, damaged kidneys, high blood pressure, and built up toxins strain the heart. And a weakened heart then sends less blood back to the kidneys, furthering the kidney damage. Listen to that again. It's a loop that basically feeds itself. This cycle is so well recognized in the medical world that it now has a term: Cardiovascular-Kidney-Metabolic Syndrome, or CKM Syndrome for short. It's the cluster of heart disease, kidney disease, diabetes, and obesity that all travel together, feeding off of each other. It's a loop, like I said. Diabetes hurts the kidneys. Sick kidneys spike the pressure beats up the heart, and a tired heart makes the kidneys even more sick. It's three houses passing the exact same problem back and forth, and it doesn't stop until someone intervenes. I want to be direct with you about why this is so important. Having diabetes plus CKD massively increases the chances of you having a heart event, and it increases the risk of you dying early. Compared to just having diabetes by itself, the combination often brings complications such as heart failure, irregular heartbeats, strokes, and severe fluid overload. And that's what makes this triple threat so much more serious than any of these conditions on their own. This isn't 1 + 1 + 1. When diabetes, CKD, and heart disease move into the same neighborhood together, the risk doesn't just add up, it multiplies. And I'm not telling you this to scare you. I'm telling you this because once you understand the mechanism, you understand exactly what power you have to step in. And I'm just telling you, everybody got choices, and I just want to make sure that you know yours. Here's the good news, and I mean really good news. Because these three conditions share the same risk factors, the same healthy changes protect all three houses at once. Better diet, more movement, weight loss where appropriate, blood pressure control, steady blood sugars. None of these are diabetes-only fixes or heart-only fixes. They protect the entire block. There are also medications now such as SGLT2 inhibitors and GLP-1 receptor agonists that can lower blood sugar, protect the kidneys, and protect the heart, reducing the risk of heart failure and other cardiovascular events at the same time. If your provider has mentioned one of these to you, this is exactly why. One repair call fixes all the houses. When you lower your blood pressure and lower your blood sugar, you are patching the street, the wiring, and the water system all in the same visit. Let me give you some simple rules that you can remember and use. Keep the pressure low. Take your blood pressure medication as prescribed by your provider and make the lifestyle changes that support it, because this protects your heart and kidneys at the same time. Keep your sugar steady. Aim for consistency. We don't want any of the wild highs and the wild lows. Move your body and eat smart. Get regular movement in, cut back on salt, cut back on ultra-processed foods, and lean into a diet that better supports your heart and your kidneys. Don't skip your checkups. Regular office visits and lab work is how we catch things before they become an emergency.
You do not have to be a medical provider to understand your own neighborhood. You just need to understand how these houses affect each other and where you have the power to step in. If you're a caregiver or if you're managing this yourself, I want you to walk into your next appointment and ask your care team one simple question. What's our plan for all three? Heart, kidneys, and diabetes, not just one. Because when you live in this neighborhood, the smartest move you can make is to stop treating each house like a separate problem and start protecting the whole block. Every healthy meal, every walk, every blood pressure check, every medication taken as prescribed. Those aren't just helping one disease, they're protecting your entire neighborhood. If this video helped you understand the connection between diabetes, kidney disease, and heart disease, subscribe to The Neighborhood MP. Every week, I'll break down complex kidney topics into language you can actually understand. Share this video with them. It might be the explanation that finally makes everything click.